Process PRP kit, the anticoagulant, a scale, a syringe, and the centrifuge are required to extract the PRP. And you must use a swing rotor centrifuge instead of a fixed angled one due to the nature of Process's design. The first step of the PRP extraction is to extract the anticoagulant into the syringe to draw blood. Recommended anticoagulant includes acid citrate dextrose solution, citrate phosphate dextrose solution, and sodium citrate. In addition, you may use citrate series anticoagulant. Take 25 to 30 cc's of blood from the patient with the syringe containing the anticoagulant. Slowly shake to mix for about 30 seconds, moving the syringe in the motion of a figure 8 so that blood sample and the anticoagulant can be mixed well. At this time, hold a ratio of 1 to 10 for anticoagulant and blood. After disinfecting the universal joint on the upper lid with an alcohol swab and the like, inject the blood into the separation kit. At this time, you may use any of the two nozzles. After injecting the blood, turn the upper lid 2 rounds to let the upper part open up to the lower part of the container. Next, turn the adjustment handle downwards to let the blood down to the lower part. At this point, please note that you should get space in the lower part by letting the handle down to 15 on the increment line of the graduation on the lower part. This is so that the buffy coat can be formed on the lower part of the separation kit after the first centrifugation. Prepare the counterbalance kit with the same weight as the separation kit. You must be careful because non-identical weight of the counterbalance kit and the separation kit or non-use of the counterbalance kit during centrifugation may cause serious damage to the centrifuge, as well as failure to separate the blood correctly. Configure the centrifuge based on our product. If the centrifuge is from another company, reset based on the value of the RCF, and then carry out the configuration. After the first blood separation, you can see the buffy coat formed on the lower part of the separation kit. Raise the buffy coat layer up to above the buffy coat check area using the adjustment handle on the lower part of the patented Process PRP kit. Then close the upper lid for the secondary concentration process to cut off the upper part from the lower part of the separation kit, and shake the container to mix plasma and the buffy coat. You can obtain the PRP, the final output, through the secondary concentration process because the buffy coat and the plasma obtained after the first centrifugation is a low concentrated PRP. First, determine the concentration of the PRP to extract using the adjustment handle on the concentration kit. The concentration level can be adjusted from 2 cc's up to 8 cc's. Slightly turn the upper lid to let the upper part open up to the lower part of the container after injecting the low concentrated PRP for the secondary concentration process of centrifugation. At this time, you can use any of the two nozzles after disinfecting the nozzle with an alcohol swab and the like. Prepare the counterbalance kit with the same weight as the measured concentration kit for the secondary centrifugation in the same way as the first centrifugation. Carry out the secondary centrifugation for a concentration process after setting the machine to 3300 RPM, 3 minutes for both men and women, unlike the first centrifugation. After the secondary centrifugation, close the upper lid of the concentration kit for the PPP on the upper part and PRP on the lower part to be cut off from each other. Thoroughly mix the PRP in the container and take off the bottom cap of the concentration kit designed to prevent any infection or contamination. Then, disinfect the nozzle with an alcohol swab and the like, and extract the PRP using the syringe. Make use of the extracted PPP depending upon the prescription and treatment method. The final separated PRP can be used in various areas such as beauty treatment, orthopedics,